right, good afternoon, everyone. Thanks for joining us. We have with us today, like we've been doing every Wednesday, we've got Mayor Lea, Vice Mayor Cobb, and City Manager Bob Cowell, and we have our special guest, I feel like we're watching Hollywood Squares, Chief Hoback up there with Roanoke Fire-EMS. So I just ask everybody to mute your lines, and maybe, if you don't need to be on the video screen, you can go ahead and stop your video, and then we will get started. So Mayor Lea, go ahead and kick us off.
Thank you very much, Tiffany, and good afternoon, everybody. The City of Roanoke will be participating in Lighted Blue, an international campaign where buildings and monuments are lit in blue to show support of the essential workers during the response of COVID-19. In conjunction with Carilion Clinic, Poe and Cronk, and the owners of the Wells Fargo Tower, the city will thank our local heroes by lighting the Roanoke Star, the Berglund Center, and Wells Fargo Tower blue starting tonight through Sunday evening. This will be the first time ever the star has been lit blue and white. That ought to be spectacular should be to a lot of people. It is so important that we recognize the commitment of our healthcare workers, Fire-EMS personnel, and all the people who perform essential services we depend upon, including store clerks, mechanics, and sanitation workers. This campaign is an opportunity for the city to say to these workers, thank you for your sacrifice and commitment so that your community can fight COVID-19. I look forward to hearing from Fire and EMS Chief, probably one of the better ones in this Commonwealth, Chief David Hoback, in a few minutes as he shares some of the details of the outstanding work his staff is doing in this crisis. And I now want to bring on our Vice Mayor, who's doing an excellent job, Vice Mayor Joe Cobb.
Thank you, Mayor Lea. It's good to be with you all today. I want to highlight some of the community support we are receiving from so many partners during the COVID-19 health crisis. United Way of Roanoke Valley is offering many ways to help meet the needs of our community members during this crisis. For example, through April 12th, the organization's COVID-19 Community Response Fund has raised $76,374. This fund complements the work of public health and government efforts by expanding local capacity to address all aspects of the COVID-19 outbreak as efficiently and effectively as possible. The money is being used to address needs such as PPE, which means personal protective equipment, and supplies and rapid testing kits. While these have been difficult to obtain, United Way is working with vendors and local resources to acquire quantities of them. United Way is also working with Feeding Southwest Virginia, Hands on Blue Ridge, the Rescue Mission, LEAP, and other local organizations to make sure our community has access to food. And along those lines, I also want to commend Roanoke City Public Schools for their extraordinary efforts in making sure our children have access to food during this time. In partnership with United Way, Bank on Roanoke Valley is offering assistance to our community to help provide free or low-cost banking. More information about what United Way is doing to help our community can be found on their website at uwrv.org. The Small Business Development Center is offering assistance to businesses affected by the COVID-19 crisis, and they are currently looking for volunteers as well. They need people with financial backgrounds to work with small businesses who are wrestling with the different grants and opportunities and resources that are available to them. I also want to let everyone know about the Community Foundation serving Western Virginia. This organization is accepting applications from nonprofits for unrestricted disaster relief grants to assist with financial resources. You can visit their website at www.cfwesternva.org and then click on the Nonprofits drop-down menu and select COVID-19 Community Foundation Response. These are just some of the resources available throughout the Roanoke Valley to address our residents' needs during this time of crisis. And again, I want to say how grateful we are for all of our community partners who are helping make a difference. And finally, I'm proud to say that we live in a community where people truly care about each other and are demonstrating that concern through creative and extraordinary efforts such as these and efforts that we're seeing every day. So thank you all very much. And now it's my honor to introduce Chief Hoback.
Thank you, Vice Mayor Cobb. And I will tell you that our organization is doing very well under the circumstances of the pandemic. And it's really in great part to our staff. The men and women of our department have really stepped up. They've been innovative, been creative. They've been understanding about the new environment from which they're asked to work in. They have designed new ways of doing business. And not only doing that, they're also developing new ways in which they communicate that out to the public. The most recent innovation that they did was the tent that we have implemented as we give aerosol treatments, breathing treatments to our patients. As we get out here and work with the public, they're very understanding about having to be masked up themselves, as well as our providers, as we approach them and actually hand it to them as they go in their houses. So from a community perspective, we've gotten tremendous support. But on the other hand, I will tell you that our staff has really stepped up and again, being creative and innovative about how we do business. The men and women of Roanoke Fire-EMS, since this started, we started out early about making preparations so that we could keep our workforce healthy. And what we did initially was we were one of the first departments that actually started putting the mask on the patients, and that was at the advice and direction of our medical director, so that we could keep our people healthy. But simultaneous to that, we also implemented a situation where when people report to work, our staff reports to work, they go through a health screening so that we know when they come to work, they're not symptomatic as it relates to anything that would be contagious. And they go through that screening twice, once when they get to work and once about halfway through the shift at 7 o'clock. With that, we've had about a dozen people tested for the COVID-19. Everybody's come back negative. We're very fortunate for that. And we've got a good, healthy workforce. All of our stations are up and operational without question on that aspect. But the downside of that, they're not open to the public. This is a big change for the fire service. We're community-based. We want the community in our fire stations. We want them to see us in action. But for the last probably 60 days, we've been very closed off for the community. And that's one of the hardest things we've had to deal with as the department. But on the other side of that, we've also had a tremendous outpouring from our community leaders and business owners about bringing by donations, whether it's PPE, and we've received some PPE from different organizations throughout our valley, but we've also received food and feeding our first responders. For that, we're very grateful for all those who participated in that. But to date, we're doing very well. I will tell you that, like the mayor said and Vice Mayor Cobb, our citizens have really been very supportive of the stay-at-home order. EMS volume, since we started tracking this, is down about 12.5%. And our EMS volume is really driven by a couple of things, is healthcare issues, but also people's activities. And without that activity within our community, we're actually seeing that reduction of call volume, which is helping our providers, taking a little bit of stress off our providers, because every time we go out, we assume that that person could be COVID positive, and we have to treat that situation a little differently. But because our volume is down, it's really helping us prepare. It's also helping us not go through our cache of PPE like we anticipated. Right now, we're going through about 300 masks a day and gowns frequently. So our supply is starting to limit a little bit. But again, our people are stepping up. They're finding creative ways in which they can reuse the N95 masks, and then how we can do things differently with our PPE. And with that, we've been able to sustain the necessary protective measures up to date. We do have quite a few of the materials or items on order, we're hopeful that will come in relatively soon so that we can continue that. Other than that, I'll take any questions.
And I also want to use the opportunity to thank the chief and the personnel at Fire-EMS. I mean, it has been phenomenal, the responsiveness that they've provided, as the adaptability, as was mentioned, and the flexibility. So I'm very appreciative of that. I've also been very impressed with how all of the fire departments across the entire valley have worked together to make certain that each knows what's going on, and if one needs something and the other has, that they're able to make those adjustments. And they do that on a regular basis. It's just you really, really count on that when that happens now as well. So certainly want to compliment the chief and his leadership around those efforts as well. And yeah, at this point, I'd be happy to take any questions for anyone that you might have.
And I'll comment on Bob's statement. Regional cooperation is something we've always done, but this is taking it to a whole different level. And we're bouncing ideas off one another, and that really helps. So we're working closer together than we've had in the past. So this is really good. It's a good way for us to build the future. So we're excited about that aspect of it. We want to get, like everybody else, beyond this pandemic and get life back to normal. But we're excited about some of the learning aspects of what we've been able to accomplish.
Absolutely.
All right. Anybody have any questions?
This is always the awkward moment.
Everybody's typing, everyone's thinking. Okay.
Now they're coming in.
All right. So Ralph with Roanoke Times, can anybody comment on the governor's announcement that recreational businesses will stay closed an additional 2 weeks to May 8th?
Yeah, I mean, I'll start, and certainly Mayor or Vice Mayor, if you want to join in as well. You know, obviously we knew the order 53 was set to expire next Thursday, and there was obviously anticipation that the governor would indicate something today, which he did, and extended it for another 2 weeks. At this point, you know, we now have Executive Order 53, which will expire May 8th, and then you have the Executive Order 55, the stay-at-home order, which is out till June 10th. We have been closing things kind of in month increments, so we have our facilities closed until the end of April. We'll need to assess that next week to determine if we pick up another month's worth of closures. I will be somewhat surprised if, as May 8th rolls around, the governor doesn't need to revisit that date as well. But, you know, for right now, it doesn't change much of what we have. We will obviously continue to match our closures with those that the governor has either put in place by order or by his offices making recommendations as well. Mayor, Vice Mayor, I don't know if you have anything else you want to add to that.
Well, I'm in support of that, and of the governor's actions, and I think it's imperative that we continue to make sure that the numbers are leveling down, to make sure that we're safe. And I think it's going to be, personally, I think it's going to be a period of time for us to get the confidence of the public back in terms of where we are. But everything I see, it looks positive as we go forward, and I think it's because people have been following the directive of social distancing, and we need to continue to do that. I think I heard one of the medical experts say it, now's not the time to ease up. It's put your feet on the gas and let's go. And so I just want to make sure that our people are safe and the numbers do not indicate otherwise.
Vice Mayor, anything?
I just agree with all of that. It's a challenging time for all of our businesses, and for those who are able to be open, we appreciate everything that you all are doing to honor physical distance to the 10 or under in stores. I think all of that is really critical. For those that are closed for another 2 weeks, I know this creates a lot of difficulties, and I would encourage you all to reach out to our city's Office of Economic Development, Small Business Development Center, the Chamber, all of these community partners who are there to provide resources and to help guide you through those steps to get access to the relief that's available.
All right, Eric with WDBJ, Chief Hoback, what's the threshold to test a Roanoke City firefighter for COVID-19?
Well, we have a list of questions. If they come into work or if they call out sick, they have a list of healthcare questions. And if they meet any one of those, I think it's 9 questions, whether it's a sore throat, a fever, a cough, and of something of that nature that meets the COVID-19, then we immediately test them. And being a first responder, we get the quick test so we can get them back to work within about 48 hours, 72 hours. And that's critical for us to make sure that we don't have a contamination within the station. So when they'll call us directly. Most of our staff now are very sensitive to that. So if they're sick or they have symptoms, they won't even report to work. And then they'll call our battalion chief, and then we'll line up a test for them. But they have to meet a certain criteria as far as that illness goes. And then we notify the Department of Health, and that person will go to that site, and they will be tested, and then we'll get the results back. They'll get the results back, and then they'll come back to work. Again, we've had about a dozen people tested, all of which have come back negative.
Yeah, and I really want to take the opportunity to compliment the work that the local health department has done for that kind of testing the chief mentioned. It's a very fast turnaround. They've put a priority on being able to do tests for our first responders, and that really allows us to ensure that they're getting the tests they need, but that they're not out of service longer than is necessary if they don't test positive. So I appreciate the help that they've offered.
All right, Lindsay with WSLS Chief, you're on the hot seat again. Can you explain more about the services operated out of a tent, or I guess that isolette that you were talking about?
Yeah, the isolette that our staff came up with is just basically a tent made out of PVC pipe. It is draped over a patient. And these are only draped over patients who need breathing treatments, such as nebulizer treatments and aerosol treatments, where the byproduct of after they exhale, if they are COVID positive, those particulates will float around the area inside a closed environment like an ambulance, and it can adhere, or it puts the providers at higher risk. By putting the tent over that individual, that confines that particulate to that area and only on that stretcher. So it limits the exposure of our personnel to that particulate. They're still in gowns, they're still wearing masks, they're still wearing eye protection, but it's another barrier that allows us to protect our people. That we've already done that multiple times to multiple patients, and all the patients have been very understanding of having to be under that enclosure. Now you can see through it, it's see-through plastic, so we're still being able to see them, still being able to reach in and hold their hand and give them comfort while they're having the breathing treatments. We prefer to do the breathing treatments outside or in their house, but if the respiratory condition is such that we have to do it on the way to the hospital, that's when these isolates are used. And I will tell you, it really came up. It was very inexpensive. The staff went out and bought the plastic, bought the PVC pipe, and put it together. And our medical director covers Botetourt and Salem. So those 3 agencies partnered together to come up with a design and are now all implementing that. And again, we operate under one medical director. She gives us, Dr. Carol Bernier, gives us the advice, gives us direction what we should and shouldn't do, how we can limit our people's exposure, our staff's exposure. And this is one of the major things that we could do by keeping that particulate within that confined area. In addition to that, after we do an aerosol treatment, we now have got sprayers that we will actually spray down the entire inside of an ambulance so that we can kill any of the virus or any type of disease that's because of that. So we'll spray it down before we actually leave the hospital. So we're taking every precaution we can to minimize the exposure and making sure that we continue to have a healthy workforce.
All right, Chief, Eric with DBJ. Lynchburg recently had a scare with a firefighter testing positive for COVID-19, leading to the temporary closure of 2 fire stations. What lessons can Roanoke City take away from that incident?
Well, I actually reached out to the fire chief in Lynchburg and learned a little bit about their scenarios, and they were doing everything they possibly could. But again, by doing things a little bit on the front end from us, I think we protected our staff. Obviously, we have a positive test with one of our firefighters. We will follow the CDC guidelines along with VDH about who needs to be tested, who needs to be social isolated. We practice that in our fire stations by doing the health screening and not having people report to work. We're actually minimizing that exposure. But if we have to, and we do have a person that tests positive and the Virginia Department of Health indicates that this is what we need to do based on their contacts, we have a plan in place to make those modifications within our workforce to make so that those people can go and be social isolated for 14 days to make sure that they have not transmitted or contracted the disease. But we have those fundamental things in place. We hope we never have to go there. I was reading online about Fairfax having 7 people that have tested positive. Lynchburg's had 3. But right now we're doing very well. we're trying to be as proactive as possible. Is it possible? Yeah, everything's possible, but hopefully by doing what we're doing, we can minimize that exposure.
Yeah, and I want to say too that the chief had these plans in place all the way back at the beginning of March, really, even before we had decided to close the municipal facilities. There was already this thinking going in to say, if someone did test positive, how would we clean a station? How would we actually take one station offline and make up for the service in other areas? So even though the incident in Lynchburg sort of heightened everybody's awareness of it, these are plans that the chief had put in place with his staff some weeks ago, just in the event that it might happen.
All right, Alicia with Roanoke Times, Chief, for you again. Can you expand on the strategies being used to extend the life of the department's PPE?
Well, really the only thing that we can extend the life of is the mask, and we're following the CDC guidelines, and we're actually following what Carilion is using as far as the ultraviolet lights. We bought 4 ultraviolet boxes. We put them at the hospitals and our stations so that the staff can reuse their mask up to 1 cycle. They're then placed in a paper bag, and then they're sterilized, and then after that, they're thrown away. So we're following the same guidelines that Carilion's using right now. It's working well for us. But again, the ultimate solution to that is to be able to get a fresh supply in here and be able to get what we need to be able to sustain us for the next. And we're actually looking at being able to sustain for the next, 90 to 120 days until the peak hits, and then we're down. So we're not using as much of the PPE as we are now. Right now, and since the onset of right around March, we're really burning through a lot of PPE based on having to put it on the patient and on us as well. And sometimes when we go out on a call, you have an engine company, an EMS operations officer, and the medic unit and the patients. So you're using anywhere from 8 to 10 pieces of personal protective equipment on a single call. So you can see pretty much how we're burning through that PPE. But the reuse is really on the N95s, and we're doing that following the same guidelines that Carilion's following along with CDC.
All right, and Ralph, you're asking what time the Star and other structures would be illuminated tonight.
We were just talking about that earlier today. So the answer I'll give you, Ralph, is at dusk. I don't know. The Star will come on the same time as it always comes on in the evening. I'm not sure exactly when Berglund will light and when Wells Fargo. So the safest answer to give you is that around dusk this evening is when you will first see all of those be lit. And again, they'll remain lit each evening in that fashion all the way up through Sunday evening.
All right. Okay. Question for Bob. So we've been hearing from a number of people who are worried about libraries being closed since they depend on those computers to file their taxes. Any resources available for those folks?
Yeah, this has been a challenge in the community, not only for because the libraries are closed, but also because there are a number of other resources that folks take advantage of that may get assistance in filing their taxes. I know TAP runs a pretty broad program usually that helps folks with their tax filings, and they're unable to do that at this point. That was a part of the reason why the federal government extended some of the timing associated with those filings. There's not really a good answer because as long as we're under these restrictions relative to gathering and having that face-to-face kind of communication, probably their best solution is to make some direct contact with the IRS and try to determine what other resources might be out there. They also could call 211 and find out if there are any resources being made available here locally. I know that it is a struggle, but there may still be some opportunities associated with that. Mayor, Vice Mayor, I don't know if you know if there's any other resources that you're aware of.
No, I'm not aware of any. I just know that the IRS has extended the tax process for 3 months. And so I just want to say business is not going to be going as it normally does because we're in the middle of this pandemic. And we just want to make sure our people are safe and to make sure that we don't take any extraordinary chances that we don't have to. But I'm not aware of anybody. I think there's some individual companies or some things that are doing work out there, but I'm not aware of any.
Vice Mayor?
Yeah, I would just add, It would probably be good, in addition to checking with 211, to also check with United Way. I know they're really doing a comprehensive approach to all of the gaps that might show up in terms of needs that people have, and that's certainly something I can share with them. But I think if United Way could hear from people in the community that that's a really important need, there may be some resources out there and partners, even nonprofit agencies, in addition to TAP, who are able to assist with that need.
Absolutely. Thank you.
All right, Chief, the isolates, are those on all calls or just those suspected of COVID-19?
Actually, they're on all calls that we administer nebulizer treatment or aerosol treatments, regardless of whether we suspect the COVID-19. Again, out of abundance of caution, we don't know. We absolutely have no idea whether they are positive or not. So we're treating everybody as they are positive. So regardless of whether they have the checkbox as it relates to a risk, the isolates are used on all patients that we have nebulizer treatments or aerosol treatments on, just because we have no idea. That's like most patients, even though they have a fall and they may not have any symptoms, we still put a mask on those patients, because there are people out there that are asymptomatic, that are contagious. And so we're not taking a risk. So it's really a standard. We made a conscious decision early on that everybody's treated the same, and that we all treat everybody as they potentially could be infectious. And by doing that, I think that's what's limited our exposure opportunities. And I think right now it's worked out very well for us. And again, I emphasize the public has been very, very supportive, very, very understanding of our approach and a different way of providing EMS service in our valley. But that's the way we chose early on to do business. So it has nothing to do whether we suspect or don't suspect. If you're getting a nebulizer treatment, then the isolate goes over you.
Okay, and then all ambulances are sterilized using that aerosol cleaner you were talking about after every use?
Only after the aerosol treatments, and then they're routinely cleaned periodically throughout the week. Or unless we have a really bad situation where we have a lot of contaminants in the ambulance itself, then they're cleaned at the hospital, or they're marked out of service, then they brought back to the station, they're cleaned there.
Okay, and then a follow-up question on that: how many masks and other PPE have you ordered? Where are they coming from, and when do you expect to receive them?
Well, that is a loaded question. We have 10,000 masks right now on order. In one order, we have another, I think, 5,000 N95s in another order. The 10,000 masks were supposed to have been delivered 2 weeks ago. Our tracking number doesn't show where they are, so we don't know. The N95s I know have been delayed. And from the gowns, we cannot order because the earliest delivery date we're looking at is sometime in June or July, based on the vendor's expectations. So we're working with VDM, working with the Department of Health and the National Stockpile to see if we can get some. But right now, we have chose to go a different route and have a different method as opposed to the gowns. And we recently ordered a light rain jacket that will serve the same purpose as the gowns. They're about $99 a piece. That will help us keep that that debris or that particular off our employees' clothes when they're given the aerosol treatments. They should be in this week, and that will give us another layer of barrier when we're providing these aerosol treatments. They will only be worn during the aerosol treatments, and it was a relatively inexpensive way to adjust with the lack of gowns.
And I should mention, we talked earlier about the coordination going on with the different jurisdictions, and everyone is having the same challenges here locally at being able to secure the necessary PPE. We certainly have reached out, as was mentioned, to the federal stockpile through our emergency management side of things, but everyone is trying to really struggle with some of the same issues.
Yeah, and I will say that my deputy chief just came in, and we did get a shipment of gowns today. We weren't expecting them, but they did come in, but it was only 300.
Yes, timely, Chief.
Breaking news, right?
He was watching me, so he said, "Oh, I got to go in and tell him."
All right, does anyone else have any questions for our esteemed panel here?
Well, if not, again, thank you, Chief Hoback, for joining us this time, and of course, Mayor and Vice Mayor as always. And the expectation is we will be back here again on Wednesday to update folks with where things are as we go along. So thank you all very much.
Thank
Thank
you.
y'all.
Thank
Thank
you.
you.
Everyone stay safe. Bye-bye.
Bye.
Bye.